We know that colon cancers develop because of abnormalities in the genes. And some of these abnormalities can be targeted, and this therapy, for the right situation, can be very effective in controlling cancer and improving outcome and survival. Chemotherapy generally is given because it works on cells that divide rapidly, like cancer cells. But chemotherapy will also affect other cells that divide rapidly in the body, and they may be normal cells. Targeted therapy is aimed more specifically at changes that relate just to the cancer cells. By blocking the receptors that help tumor cells grow, or sometimes help blood vessels grow, we have the ability to shut off this stimulant to grow and multiply the cancer cells. The use of targeted therapy has increased quite significantly in the last 5 to 10 years, and we've seen significant improvements in outcomes in patients who receive targeted therapy for metastatic disease. We know that in those patients that adding different types of targeted therapies can improve survival significantly compared to patients who are not receiving targeted therapies and just receive chemotherapy alone. There are some very specific situations where the targeted therapies work. They don't work all the time, and it's important for patients to discuss that with their doctors as to whether or not they're a candidate for the targeted therapies and what the best type of therapy would be based on their specific situation.